Cami Wolf Rice is no stranger to hospital waiting rooms. Her son, Christopher, was diagnosed with a colon disease as a young boy and was in and out of the doctor's office for years. As a senior in high school, Christopher underwent a procedure to have his entire large intestine removed.
And this is right when Purdue Pharma came out with the wonder drug OxyContin. And so we didn't know. I mean, we just listen to doctors, right? We don't think about asking questions. And we went home with 90 OxyContins. And now looking back, he was devastated and became addicted just with that one prescription.
Christopher went on to struggle with opioid addiction for years after his surgery. Rice says they weren't taught the dangers of these drugs or how to safely taper her son off when they were no longer necessary. At the age of 32, Christopher died from an overdose. Rice decided she couldn't let the cycle continue and rip apart another family, so she created life care specialists.
It really was about taking my pain and turning it into purpose. And that's really what's helped me grieve the loss of my son, is being able to provide everything that he did not have when he had a health crisis and that I didn't have as a caretaker. I'm really just trying to help other people from going through the pain that I've gone through. The whole idea, though, is to prevent addiction, right? To stop it before it starts, because many times addiction starts with that first prescription. And we went into orthopedic trauma because that's usually the first place a young person is introduced to opioids, by a gymnastics injury or football injury, a car accident, something like that. And then it literally, their whole trajectory of their life can turn a different way.
Rice realized that we have coaches for everything from sports to investing, so why don't hospitals have a position solely dedicated to getting patients through a health crisis?
You need a coach to help you get through and to educate you and to help you manage your pain and your anxiety and your stress and your depression. And nurses don't have time to do that. And so I built this position based on everything that Christopher didn't have. And then I was fortunate enough to meet Dr. Mara Shanker, the chief of surgery at Grady. And, you have to have a champion in a hospital. And she literally, we became locked and loaded, and we did a clinical trial for 2 years. All through COVID, we were able to continue our trial. And now we're expanding. I mean, it's really taking off because it's a missing piece on the healthcare team.
Grady Memorial Hospital, where Dr. Mara Shanker is the chief of orthopedics, was ground zero for this new program. Shanker says she's in contact with the care coaches nearly every day.
My vision truly aligns with Cami's vision. When we thought about this 5 years ago, she came at it from the perspective of a parent who had a son who was in the hospital. And I come at it from the perspective of being a physician who wants to help, but may not necessarily have the resources. And the two combined became this concept of the care coach.
At Shanker's hospital, the care coaches are on her floor to help the orthopedic trauma patients. They provide information about opioids and how to safely use the drugs to manage pain. Though it may seem hard to believe given the rates of opioid use in America, Rice says some people don't have any knowledge about the prescription medication.
Many patients don't even know they're taking an opioid or what an opioid is. And we do follow up with patients, which is so critical to make sure that they're off of. Sometimes you have to be on an opioid, but the key is getting off of the opioid in a timely fashion. And we talk about the side effects. And so we try to give alternatives to things that you can do for pain besides taking that pill.
Which Rice believes can save lives, especially since 1 in 4 patients using opioids as a long-term therapy end up with an addiction, according to the CDC. Unfortunately, many addictions end in death. In fact, 76% of all drug overdose deaths in 2023 involved an opioid, which is 1% higher than 2020.
One thing that we were hoping to do with this is to decrease reliance on pain medications. So when I was in medical training, we were told, somebody has pain, how you treat pain is with a pill. And this is, relatively recently that I trained, but even in the last, 20 years since I graduated from medical school, things have changed so much with the opioid epidemic. And so, goal number one was to decrease reliance on pain medications. But the flip side of that is, well, how do you treat pain if you're not using medications? And that was something that we were never trained in. And so they also help people with other strategies for coping with pain.
These strategies include meditation, mindfulness, and breathing exercises. And though opioids are certainly powerful agents to get rid of pain, these alternative options don't carry the threat of addiction.
We do music therapy. We do sleep therapy because so many patients have a hard time sleeping in the hospital, and sleep is such a key component to healing. So we have all kinds of tools in the toolkit, but they also do an assessment of the patient because it's not one size fits all. What helps me might be very different than would help you when you're in pain. So you really have to assess the patient to understand what's best that's going to help them get through that time.
And sometimes having an individual assessment is valuable for more than just pain management. Schenker says the care specialists are often able to notice underlying issues that would usually be overlooked in the hustle and bustle of any hospital.
So sometimes patients come in with a history of alcohol misuse or other substances that we would have never found out because they come in with a broken leg and we treat their broken leg and that's it.
But with care coaches, these patients can get additional resources within the hospital for substance use disorders or mental health issues. This new position does take some responsibility off of the doctor's plates, but Schenker says it helps out the nurses most of all.
Nurses are the ones who are seeing them all the time while they're in the hospital, and this gives them some out other than a pain medication and someone to help them manage patients who are in pain. And then really it's a new role because it provides other strategies for coping with pain that have never really existed in the inpatient setting before.
Rice says that one of the most valuable parts of care coaches is their ability to give patients comfort and a listening ear while in a space that always seems to have an emergency going on.
People are coming in and out of the hospital. They're poking you. They're doing all these things. We're not there to hurt, harm. We're there to just care for that patient, to set them at ease, and to help with the fear and the anxiety.
Since the inception of Rice's idea nearly 7 years ago, Care Life specialists have expanded into rural areas, the sickle cell community, and have goals to move into emergency departments. On top of creating these coaches, Rice details how addiction has affected her own life in her book, The Flight, My Opioid Journey.
And I wrote about my journey, but it turned into so much more because it helps the reader understand their own journey, because eventually somebody's going to get sick in your family or you will. Unfortunately, that's life. But it's also just about forgiveness and compassion. And I talk about a home invasion that I had and how you keep hope and you keep flying on that journey. Because ultimately, every family knows one person struggling with self-medicating, and stop the stigma.
All of the proceeds from Rice's book go towards getting more life care specialists in hospitals around the country. The Flight is available now wherever books are sold. You can find more information about Cami Wolf-Price, Dr. Mara Schenker, and all of our guests on our website, radiohealthjournal.org. This segment originally aired in February 2023. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.